Welcome back to Medical Coding with Blue. Today's episode is all about salary expectations, non-money talk, and benefits for medical coding. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, first things first, I gotta say this. Yes, I did say non-money talk when I'm talking about salary expectations. The number one rule of my channel is that we never talk about money in specifics, like dollar amounts. For medical coding on my channel. The reason for this is because every place pays a different amount of salary to beginning brand new medical coders. If you're in California, you are not going to make the same as a brand new medical coder as somebody in the state of New York. Same thing with Florida. You're not going to make the same thing as somebody starting out in Michigan. The same thing with Texas. You're not going to make the same as somebody starting out in Arizona. And the reason for this is the cost of living. And there's a bunch of other reasons. Whether you're working for a public hospital, private hospital, government hospital, there's going to be different starting salaries for everybody. My biggest pet peeve about this industry is when I see people after the money. And they don't want to apply themselves. They don't want to learn about medical terminology, anatomy, patho. They want to be there to collect a check, and they see that salary, that hourly salary, and that's what they want, and that's why they get into it. Not on my channel. If it runs you off, she doesn't want to talk about it, that's fine. You don't have to watch my channel, because trust me, the people who want to watch my channel are the people who are serious about being medical coders. They want to know the nuances and the little things about this industry and being a really good medical coder. That's why they're here. Not because they're obsessed with the money. And yes, while it is important to make a good salary, and it's important to know, again, there are websites like the Department of Labor and the Bureau of Statistics that can tell you. And you don't have to get this ridiculously high salary total from a creator here on YouTube or from a school. Okay, you can get your own, you can do your own research and find that information, so that way you know and you're armed. So when you are applying and you see an employer who's trying to really lowball you and say, oh, this is what we pay, you know not to accept that assignment. You don't have to accept that salary, guys, especially if you see that the average starting salary in that area for a medical coder is a lot higher, or maybe a few dollars higher. You can tell them, okay, well, I understand this is what you're charging, but I know that I'm a certified medical coder, and I do know that the average starting salary is this. And if they're not willing to meet you there, then by all means go apply someplace else, because I guarantee you there's going to be someplace else with a better salary and who will probably treat you a lot better. So that's just something that you guys ought to know. You have to learn to do your research. And again, I don't have to be here to give you guys a specific dollar amount for you to decide whether you want to do this or not. I had somebody who commented, and these comments kind of irk me. Well, I don't want to say kind of, because they do irk me. Let's just be honest here. It irks me. This lady says that she's 60 and that her son or her child told her about getting into medical coding, but she says when she saw what medical coders make, I don't know where she was looking, but when she said she saw what medical coders make, she says that's a little too low for her. Okay, if it's a little too low for you, there's other things that you can do. You don't have to do medical coding, because again, don't get into the field of medical coding for the money, because you will be miserable. That's first of all. Second of all, the thing about the starting is that's not where you're going to stay. That is just a starting salary. You cannot expect to start off near at whatever you were making as a seasoned professional in another field when you started medical coding. That's just a ridiculous expectation to have, right? Because you can't do it. There's just no way. When it comes to, okay, this is what I make, okay, but this is what medical coders start off at, you're going to go up. But they need to be able to assess your skill, make sure that you know what you're doing, make sure you even like it before they start giving you more money. When I started in this field, I started off with my first job as at a temp agency. They gave me my first assignment in medical coding. That started off on one salary. Then I got another assignment, and that gave me another salary. And it was a jump from what I started off making. Because remember, I was a brand new medical coder, not knowing anything, just trying to learn the ropes. They started me off at a fair rate. Then they bumped me a lot on that second one. And then I got my forever home, and that was an even bigger jump. So I got 3 jumps in pay in 1 year, or I went through 3 different pay scales in 1 year. Had I been concentrating on the money, I might have said, oh yeah, no, this and that, blah, blah, blah. But for me, I was not concentrating on the money. I'm trying to get in because I know that the money will be there. And sure enough, the money has been there. I have not had to worry about money, guys, at all because of doing this. And that can be you too. But if you are fixated on that dollar amount, that's where things can go awry. Instead of where can I go to get experience so that I can learn the most that I can, and I could take those skills and move on to the next place. And then I could move on to the next place, or whatever the case may be. Okay. So that's what you can expect. When it comes to that salary, guys, look at the Department of Labor or the Bureau of Statistics. And if you see that they are really, trying to undercut that pay when you first get in there, then don't apply there, or don't accept that position, or use that to negotiate a higher starting salary, guys. You have to learn to use your voice. Use your voice so that you can advocate for yourself, but also show them what is it that you know. By your test, they're going to be able to, when they give you that test to assess your skills, they're going to be able to know if you really do know what you're doing, or if you're going to need a lot of support. Don't be the person who needs a lot of support, guys, even if you didn't have a good teacher at your school. You can learn this on your own. There's the independent study video link that I have in the description box, and it has all the books in the syllabus that you need to be able to study on your own. And yes, I do say that you should do this even though you already have your certification, because if you've gone through a fast-paced medical coding program, I guarantee you there's a lot that you could still learn. So that's just what I would recommend there. Be realistic about what you're going to start off at. Do not expect to start at what you've been making, because that's just foolish and you're setting yourself up for heartache, okay? So think about that and consider that. Yes, look for a fair starting salary, but make it comparable to what the Department of Labor or the Bureau of Statistics says in your area, so that you have something to negotiate, okay? And if you have other skills and you're going to be doing other duties, then by all means negotiate that way. But for my people who are just starting, that's something that you ought to know. You will start at a lower rate, but that's not where you will stay, okay? And if it's too low for you, you can always go and look at another place. So that way you can find something that is more suitable for you, okay? So that's the starting, that's the realistic expectations about the salary, okay, guys? You don't have to accept a bad salary, all right, just because you're trying to get experience. You can go to another place, because trust me, they all pay differently. The other thing is this, some of the benefits of being a medical coder. Now, if you get an assignment working a contract, you're not going to get benefits. Usually a contract is they're going to pay you a set amount for working so many charts, and then that's it, and that's what you get paid. And however fast you work through those, that's basically what the money that you're going to get. And then you're on your own with insurance and that kind of thing. Okay. So while working contracts can be a nice supplement for some people, or it can be a nice beginning for those that are really not kind of sure, it's just something that you have to know that they usually don't pay for benefits. All right. So that aside, everybody needs health insurance and all these other things. But when you go to a place where, you're hourly working and that kind of thing, there's a good chance you're going to be able to get benefits. Like I said, every place is different. So don't automatically think that this is for everybody. This is the same, but most employers do provide health insurance. Other than that, you can go to the marketplace and get your health insurance that way. And for some places, they give you paid time off, or PTO, and sometimes they give you sick leave as well. Sometimes it's a combination of both. Of course, you can find out by that particular employer, what it is, how much time do you get off per year, and that kind of thing. So that's the thing that you need to know. And I'm going to be talking about questions you should ask during your interview later this week. But that's typically what they do offer, like paid time off, sometimes sick leave as well. and sometimes it's together. It really all depends. Life insurance, health insurance, depending on the employer, how big the employer is. If you are working for a smaller doctor's office, there's a good chance you're not going to get all those bells and whistles, which is why I always recommend that you apply for a hospital, apply at a hospital. There are outpatient coders that do work in hospitals, so don't automatically associate working in a hospital with inpatient coding, because while it is done there, they do have outpatient clinics in a hospital. So they will need outpatient coders. And a hospital is just a bigger organization, and they're going to be able to offer you more benefits. Sometimes there are union benefits, like if you want to join the union, if there is a union at your hospital, then there's a lot of different benefits there. Some unions have a lot of really good plans. Some even offer pet insurance. So if you have a pet and, this hospital of has, a union, sometimes you can buy pet insurance, pet health insurance through the union. That's just something that I've heard of. So one of those awesome benefits out there. Another benefit that the employer may have for you is that they pay for your continuing education units. Some do, and some will give you continuing education units as a condition of your employment. At my facility, we get one CEU per month, because we have like monthly education meetings for coders on different subjects, and we do have the AAPC approved CEU. I can use that on my AHIMA credentials. So even if your facility has, AAPC CEUs, you can certainly use those if you have an AHIMA credential, because AHIMA does accept AAPC CEUs. So that's something to know. It's a great benefit, and it saves you money. And some employers will pay for your membership dues to the association. Some do and some don't. I've been very lucky before. My facility doesn't pay for my my membership dues, but I have been able to have my membership dues paid for in the past. So by another company that I worked for. So that was quite nice. It's a nice little bonus at the end of the year when I'm paying for my membership and I get the money back. So that's really good. And it's just a nice little perk. And that's another thing that you can find out. It's another benefit that is also there. Some employers, this is the best one, they do offer tuition reimbursement. So if you are interested in pursuing a degree later on in your career as you progress and you're learning, right? If you want to pursue a degree, check with your employer and see if they have tuition reimbursement. That is a great and wonderful benefit that a lot of people don't even take advantage of, because, I don't want to do school and I don't want to do this. If the employer is willing to pay for your schooling, by all means, take advantage of that, because it's better that it comes from the employer and not out of your own pocket, right? So that's just something that it's just an added benefit out there, something that you can check into if that's available at your facility. So that's something to know. But yes, there's a lot of different benefits. What else can I say about the benefits? Other than like PTO and sick leave and things like that. There's just a lot of different things for some people. Like I said, they do all kinds of things for the CEUs. Sometimes they will pay for you to attend the national conference, or they will give you a stipend so that you can purchase whatever CEUs you want to. And again, that's all on the facility if they want to do that. I am not high up enough on the food chain currently to have my my conference attendance paid for. I usually pay for that out of pocket. I have always paid for it out of pocket. But to me, that's an investment in my education and well worth the expense. So that is something that I do pay out of pocket for. And again, I am happy to do it because, again, it makes me sharper and it makes me better at my craft. And that's the most important thing to me. So, there is that. And if they are paying you to find your CEUs however you want to, there's lots of different online programs. HC Pro has a lot of really awesome boot camps that do include CEUs with the completion of those boot camps, and they are approved through AHIMA, they are approved through AAPC, they are approved through ACTIS. So there's a lot that you could choose from there, because as you get more credentials, obviously the amount of CEUs goes up. Now, I've always said to be very particular about adding on credentials to your name. They should not be something that you've already been tested on. For example, the CPC covers outpatient coding, all the specialties. It covers billing, it covers HIPAA, it covers auditing, it covers everything, okay? Because you have to look at all of that stuff when you're taking this exam. Well, of course, AAPC has their breakdown of all the different credentials, and people think that, the more credentials you have, the more money you'll make. It's not the way that it works. Typically in this industry, we are paid for our knowledge, not the amount of credentials that we have. Because there are people who have a bunch of credentials who cannot code to save themselves. They cannot code basic things. And they only did it to rack up the credentials because they think it makes them look more prestigious. I am not impressed personally, because I've been around long enough to know the difference when it comes to that. So be very particular when you're adding on credentials, all right? Because you're going to have to pay more in CEUs. And if you are paying more in CEUs, that means that's less money into your pocket at the end of the year. So keep an eye on that, guys. It's an expensive field. Medical coding is not cheap. We make good money for a reason, but some of that goes back to the associations. If you're with AAPC, people say, oh, AAPC is easier. No, it's not. I've seen people fail those AAPC exams all the time. Trust me, they come to my channel and tell me about it. But it is a $205 charge every single year for that membership in order to maintain that credential. If you do not pay the AAPC organization their $205 every single year, they will take your credential away. So that's something that you guys got to think about, all right? So I'm just saying that you have to consider all these things when you're tacking on all of these things, because it will affect your benefits later on. As far as like, oh, I have to spend more money, or I have to try to get more of these CEUs, or I have to spend more time in education so that I can maintain these credentials with all the CEU requirements that are required of them. So, but yes, that is my episode for today. There are a lot of benefits to being a medical coder. There's a lot of things that we have, all of our responsibilities and things like that. But you cannot be fixated on the money, guys. You can't. It's there. You don't have to worry about it. What you have to worry about is staying educated. And trust me, the money will come to you. The money will have no problem showing up. And as I've said, I have not had to worry about money because I have not worried about the money. I've only worried about bettering myself education-wise. And that has gone a long way to planting that seed and harvesting now, okay? So that's just something that you guys got to know, all right? And the pay scales are going to be different, and the amount of raises that you get and the bonuses that you get, because some places do give bonuses, all right? Not all. Not all. And some will be quarterly bonuses, some will be yearly bonuses. So really, again, it all depends. But those bonuses go hand in hand with the amount of education that you have, how educated you are, how accurate you are, right? And all of the other things that you are doing. And again, because I have never worried about money, I've always been okay there. I've always been okay in that department. And the fact that I do a good job regardless of whether I get extra money or not, again, has always saved me. That has always been a benefit to me, because whether I get a bonus or not, I'm still going to do a great job because my providers and those patients are number one in my mind. And that's where I'm going to focus my attention. And again, that having that mentality and that attitude has never let me down. Just like being here on this channel and giving you all this information, and sometimes that tough love that some of you all need because you're fixated on the wrong things. Don't get fixated on the wrong things like salary, guys. Don't chase the money, because again, you chasing the money is going to make you miserable. All right. And if you don't believe that, if that philosophy doesn't align with what you think and you just can't stand it, you can't stand me, then don't watch my channel, guys. It's okay. I have 25,000 subscribers plus that I've managed to get on my own, being myself with my personality, giggles and all. Because I was told, oh, don't laugh. Well, don't watch. It's that simple. So anyway, I will continue to be here laughing, giggling, sharing my joy of being a medical coder with all of you, hoping that you all will prepare using the guidance that I have given you. Again, all of that information is in the description box below, guys. It's just a simple click and you see all those things, my contact information, my rates for tutoring, my rates for writing resumes, all the links that I recommend. It's all there in the description box below, guys. So with that said, now I will wrap this up because the true Texan in me has to talk a few more minutes. So I'm going to wrap this one up. If this video was helpful for you, I hope that you will like and subscribe and share, and I will see y'all next time. Bye.